This video is for informational purposes only and is not intended to be a substitute for professional medical device, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding any medical conditions. And now over to Rod Hochman.
Great to be with you. This is Rod Hochman, and today I've got two wonderful guests with me. Today is Earth Day. It's hard to believe that in the midst of COVID-19, but I'd like each of you to introduce yourself. I've got Allie and Beth with me. Maybe Beth, you've got a new role at Providence St. Joseph Health. Maybe a little bit about you, and then I'll turn it over to Allie.
Great, thank you. It's so nice to see you and nice to be on today. Yes, my name is Beth Shank, and I'm a nurse, and I've been with Providence a long time, 30 years. I have had an interest in environmental stewardship for most of that time. That has led me to work in the hospitals to get my doctorate, and in which I studied the environmental impacts of healthcare. And I've been working on local, hospital, regional, and system-wide ways to reduce our pollution and build more health in our communities ever since. And yes, I'm today being introduced in my new role, which is the Executive Director of Environmental Stewardship for Providence St. Joseph Health. Thank you.
And we couldn't be more blessed to have you on the team, because I remember when we met each other 6 years ago in Missoula, and you took me by storm, and it was very, very clear, and it was fantastic to hear. You had an agenda. You knew what we needed to do. And I remember coming back to Seattle and saying, wow, you got to meet this person. She's really got it. And I'm so glad that we could kind of put this all together, and we'll get into kind of what a meaningful difference we could make. And I know on the other side of it, Ellie Santori, Ellie, maybe you can introduce yourself and your role in all of this. You wear a couple of hats.
Sure, absolutely. Thank you so much for convening us today on this special Earth Day and for your leadership in this important work. So I have the privilege of leading government affairs and advocacy operations across our 7-state footprint and in Washington, D.C., as well as leading our overall environmental stewardship and energy management to help our system achieve measurable improvement in our environmental footprint. And I'm just so grateful that Beth has recently joined the team, because she's going to take the organization and the world by storm in advancing this work.
Fantastic. Well, Beth, here we are. We're in the middle of basically a shutdown in the United States. And one of the things that a lot of us have thought a lot about is about the environment, with less planes flying overhead, less cars. What has been the impact on the environment of basically shutting things down? What out of the negatives come some positives, and what would be your observations?
Yeah, it's a really interesting time to see this, to see the Earth basically take a breath, to see all of us take a breath and a pause. And that may be one of the best ways to think about it, is when we're in this mode of really doing less, traveling less, spending less, consuming less, look at what is happening around the world in a positive sense on Earth Day. And this is not at all to ignore the incredible suffering that has also happened through this event. It's difficult to talk about one without betraying the other, but it gives us a chance to really see what happens when we live a little bit more lightly on the planet. So we're seeing less air pollution, less consumption, fewer deaths because of air pollution that normally happen. We have not yet seen, to my knowledge, a measurable difference in the CO2 levels, but that too is happening because we know there are fewer emissions. So there are a number of really positives that we can see without denying also the negatives, of course.
Sure, absolutely. And Allie, what do you think this means as we have been very active on the climate change initiatives, given the fact that, the other benefit that I see out of all of this hardship is that science really matters. And talking to a lot of scientists around the world, we're quietly going, maybe they'll kind of listen to us a little bit more. Do you think there's any potential for some spillover to environmental science?
I do. I think that, for our organization, we've really taken the words of Pope Francis and Laudato Si to heart, and recognizing our role and our need to improve internally, but also the government's role at the state and federal level in driving some of that change. So, for example, the 10% of national greenhouse gas emissions come from the U.S. healthcare system. So we have a responsibility to act ourselves, and then a responsibility to also push government to act. And I think that this focus on science and wellness and health that the whole world has really been tuned into is going to go a long way in advancing some environmental stewardship policy, perhaps not at the national level right now, but certainly really energizing that debate at the state level.
Got it. Beth, you know, we've developed a pretty comprehensive plan to kind of look at environmental stewardship as it relates to a healthcare organization. And maybe, you know, I know you've, you know, taken the first swings at that. Maybe for our audience, what does it mean for a health system of our size in 7 states to look at changing our carbon footprint, becoming more environmentally aware? Maybe you could run us through what are some of the components of that?
Well, in the big picture, yeah, I can do a quick little mnemonic that I use called We Act. So I like that reminds us that we need to act, that this is in our hands, but also it describes what these various content areas are. The W is for waste. Healthcare creates a tremendous amount of waste, and we can both reduce that and make sure it goes to the right place. The E is for energy and water. That's one of our bigger contributors for our greenhouse gases. So we have plans in place to both become more efficient, to buy more renewable energy, and we will reduce our carbon footprint that way. The A is for agriculture and food, because that too presents a fair amount of greenhouse gases. It's estimated from 9 to 20% of our greenhouse gases. The C is for chemicals. This is the one that you're probably most familiar with is some of Dr. Brian Cheesebro's work in terms of anesthetic agents. So those are potent greenhouse gases that we can do something about to reduce. The T is transportation, and we were mentioning earlier about how convenient it is for us to meet like this without actually having to travel to be in the same place. So those are some of the ways that all of us, both at home, at work, and in our advocacy, can really impact this and meet our goals.
Beth, I thought it was fascinating. I heard a very detailed presentation on the anesthesia gases, and it was something that was, wow, I had never thought about it. But for our audience out there, if they're about the same that I was, I didn't realize the tremendous extent. So maybe just a few more words on that, because I think ordinarily we wouldn't think that should be an issue.
Right. It's when I talk about it, people have never heard of it either, and it's really interesting. So there are some common agents that are used, inhaled agents, and one of them in particular is a very potent greenhouse gas. So when anesthesia is delivered, and I am not an anesthesiologist, so this is my interpretation, but when the anesthesia gases are delivered, they do their work in the body, they're exhaled. We scavenge them out of our ORs and vent them straight into the atmosphere. Chemically, they're not changed, so they are potent greenhouse gases both before use and after use. It's not required that we collect them. It's difficult to collect them. So that turns out to be some significant greenhouse gas emissions that we're contributing, and we don't have to. So for instance, Dr. Brian Cheesebro has really helped some of his colleagues and peers and the people who deliver anesthesia, both MDs and CRNAs, to make different choices that clinically are just as good, just as effective, but they don't cause this pollution. And by the way, they're a lot less expensive. So that's a nice example of when cost savings goes right with environmental savings, which is very often the case, actually, because it's all about conservation of resources.
Right. Got it. And it is, very, very significant. And it's a kind of information we want to make sure we get out to everyone, because it really is a breakthrough. Allie, what if, you've had to figure out a way to get us organized as we're a large health system, as everyone knows. We're in 7 states. We've tested a little of this with COVID-19 about how well we're organized, but you've had the same challenge with Beth to figure out how do we organize a large organization like this around the environment. Maybe you could tell us, how did you figure out how to get us organized?
Yeah, absolutely. I mean, we know as a system, Beth's example about the anesthetic gas is a perfect example. We have so many levers at our disposal in order to improve our environmental footprint. We have large buildings and hospitals that emit energy. We have the clinical sector, which is also emitting greenhouse gases. So the couple of things that we have done to really get us organized and improve our environmental footprint is first to measure it. We cannot change what we cannot measure. And so through measurement and data, what we first did across all of our 7-state system is to implement a comprehensive sustainability platform that tracks and reports energy, water, waste, and usage by facility. So we now have over 600 sites on that platform across our 7 states. So we have a true understanding, a real-time understanding of what our environmental impact is day over day. And so what we've done is we've learned through that data management, that 20 facilities across Providence amount to 70% of our energy emissions. So we then can take the necessary steps, and we've just embarked on energy assessments of those facilities to identify really quick win efficiencies that we can implement. Beth was talking about what we really look for, which is, we're Catholic, so everything's in a trinity, is the triple bottom line. What's good for the planet, what's good for the patient, and then what makes the most sense financially. And when it comes to environmental stewardship, there are some things that we could do across the system that promote that triple bottom line.
Right. The other thing also is, how to get spread. And I know, Ellie, you've been having a lot of discussions with other health systems as well, because the really key to this environmental stewardship is not only what we do in our own health system, but how do we spread that amongst the 5,000 plus hospitals and facilities around the country?
Yeah, absolutely. So I would say another big component of how we advance this work and organize ourselves is leveraging our external voice. So that includes talking directly with state and federal government officials. It includes working with other hospital systems. Again, health systems are in such a unique opportunity to improve the environment working all together. So we have, within our system, we also have our very, very passionate caregivers. We have 120,000 very dedicated and passionate caregivers, and the health systems across the country also have this kind of grassroots resource to help advance environmental stewardship on the front lines. So we continue to partner with hospitals across the system to be a very loud and vocal external voice for environmental stewardship policies. And one of the things that we're doing and partnering with other systems is to join the national We Are Still In coalition, which is a coalition of really international or national organizations supporting the International Paris Climate Accord, that while the United States has officially withdrawn from the accord, we as an organization and our other healthcare partners are verbally committing that we are still in to those standards that were outlined in the Paris Climate Accord. And not only at Providence are we still into those standards, but we are actually ready to take that to the next level internally. Great.
Beth, what I hear a lot of, from a lot of folks is, how do I get engaged? It's what I think Allie was talking about. We've got the grass tops, which is kind of influencing on a national basis what's going on. But then the grassroots are really important. And I think this is something that I know a lot of our caregivers feel pretty passionately about. But they kind of will ask me, well, how do I get engaged on this? I'd really like to be part of it. So maybe what your thinking is of how do we engage our people?
Yeah, the people at the bedside and at the point of care are the people who know the most about this. They know how to save resources, how to save energy, how to choose safer products, etc. So really to unleash their passion and power is, I think, the secret sauce, basically. So there are a few structures that are in existence already. One is a system-wide call called Gases. This is within Providence St. Joseph, the Action Collaborative for Environmental Stewardship. That's open to everyone. It's on a Teams meeting. We'd love to have whoever can join. We meet monthly. Many ministries, probably at least 20 so far, do have active green teams and ways that they're doing this work locally. A lot of it really has to be done locally, but we can help support it through the region and through the system. We have just finished and just heard, this is new news, about an annual award cycle that we participate in. So this is through Practice Green Health, one of our partner organizations. And so 20 hospitals applied for awards. And we ended up, just found out about this last week, with 23 different awards for 17 hospitals. So this is the most ever, and we've been doing this since 2005. Also, if I can break some other news, that Allie right here is being honored with the Visionary Leader Award. This is in the nation this year, and that will come out later through Healthcare Without Harm. So I'm super proud about that too.
Thank you.
Wow, fantastic. Wow, so I'm learning a lot being on this with both of you, and I think, like with everything else, we really want to do it well. Are we, Beth? Are we going to have a scorecard as it relates to, not that we're competitive in healthcare, but between all of our different ministries and hospitals and clinics, who's doing what, and how do we track that?
Yes, we've really been working on the data end, as you know, and Allie was telling you about the resource advisor platform that we use. Really, that's the way we're managing our energy, water, and starting to do better with waste. We're also developing a scorecard. We have this already in Washington, Montana, which has had a council for a while. And so we are spreading that now to Oregon and Alaska, and we hope to be able to spread it soon to the rest of the health system, which has exactly what you identified, ways to compare use, waste production, food, local and sustainable foods, linen use, and the various areas that we track in an environmental stewardship program, as well as some of the areas that are less traditional, like community investment. What are we doing in our communities to help build resilience against climate change? The ways that we support our communities for public transportation, the way we contribute to energy efficiency in some of our housing. So we're really starting to look at the ways that we translate, because this is what Providence does. We translate our skill to really help those who need it. So it's not just about cleaning up our own act, which is important because we don't want to be harming things, but we also want to go further and help build this strength in our communities.
Great. Allie, we do a lot of work in all of our communities, and you're tasked also with dealing with 7 different states, all who have somewhat of a different viewpoint on environmental stewardship. How do you attack that one? I mean, because it just seems to me challenging given the diversity of, we're in Alaska and California and Texas and Washington. What's the plan there? And, what's been your way to get at that?
Yeah, I think that one of the things that we've really been empowered to feel is a fearlessness in our advocacy and standing up for the poor and vulnerable and climate resilience in our community. So we've done that across all of our states, a very vast, wide demographic from, Kodiak, Alaska to urban density centers like Los Angeles County. And so we've obviously had more traction in some areas better than others. And so, for example, in areas where we can really drive this forward, we are the founding members of the Washington and California Healthcare Climate Alliance. Providence was actually one of the drivers to bring healthcare systems together in those states to drive policy change related to climate change. So and in Oregon, we're playing a leading role in advocating for clean, renewable energy, including supporting cap and trade legislation in Oregon that almost shut down the state legislative session because it was so controversial. And so we really ground ourselves in our organizational value of justice. And that includes environmental justice. And a lot of the impacts of climate change are disproportionately felt by the poor and vulnerable. So, regardless of the political winds and which way they're blowing, we're always going to stand up on behalf of the poor and vulnerable and environmental justice. So also in California, as part of our work with the Healthcare Climate Change Council, we've engaged with the state on a food waste reduction program where we now donate unused and safe food to local partners from all of our hospitals in the state of California. So when it comes to areas that are a little more conservative when addressing climate change at the government level, we're still acting at the operational level. So Providence, Alaska Medical Center in Anchorage was one of the first facilities to undergo the energy assessment. We've identified ways to create more energy efficiency within that facility and in Alaska in general. So we're moving forward with that. So, no matter what the political climate is, so to speak, we continue to press forward.
Great. Well, Beth, I've got the closer for you, and we're in the middle of probably one of the greatest crises ever, and we're right in the middle of it. We thought healthcare reform was going to be challenging, and now we're dealing with a pandemic. What do you see the future, to speculate, from your vantage point from the environment? we're all working from home now, we're traveling less. Which of those things would you like us to do more of? What's your kind of your vision for how we go forward?
Well, that's a big question. um, I do think there are some specific things that we can learn, that we're learning from COVID about consumption. I think consumption, if we were to distill everything down about our environmental crisis, it would probably distill down to consumption. And I think that is right in alignment with our Catholic mission, with our idea of fairness of distribution, with our own use and wise use from our sisters and our founders. At the same time, we don't want to always be living with physical distancing and with a more or less closed economy. So I am cautiously optimistic that this pause will really reset some things, both in our economy and certainly in our way of thinking about consumption and use of resources. In Providence, I think it's a great time for people to be acquainted with, unfortunately, we've had this shortage of PPE. We've all something that is positive that's come out of that is more familiarity with tending and caring for our supplies, including reprocessing, including reuse and extended use, as long as it's safe. So I think there are a number of things, of course, that can come out of this, but I also know it's an exhausting slog, especially if it's going to go on for an extended period of time. I do want to say something about the optimism, though, because I think it's really important. People can get overwhelmed with both the pandemic, which has been terrifying, and also with climate change, which many people think is more terrifying. Believe it or not, it's just not quite as pressing right today. But the optimism for me comes with the fact that this is up to us. This is in our hands. Those of us who are alive right now have everything to say about this. And we think, based on what we've learned from the climate scientists, that these next 10 years are so important. And that is why I say to you, Dr. Hoffman, I'm pleased with our goal, our Providence goal by 2030. So I don't know if you've actually said that aloud yet, so I'll leave that to you to say aloud, but it makes me
yeah, that's our closer. And we're all on it. So, we've all sat and thought a lot about the goal, and I'm going to leave it, Allie, for you to put it out there for us. But we've met as a group and we've said, this is where we're at. I think it was a totally unanimous very, very quickly. But Allie, maybe as our closer, what is our goal for our organization?
Yeah, well, thank you so much for allowing me to do the honor, and thank you to your leadership, the leadership of our executive team, and to Beth. But we are so proud to announce that through our commitment to environmental stewardship and improving our footprint, Providence will be going to carbon negative by 2030, which is a 50% increase on the Paris Climate Accord agreement. So we are going to Paris and beyond with this commitment, and we are really, really very excited about the leadership that's involved in this and really mobilizing our caregivers to support this goal.
Fantastic. And I would say we're doing that and at the same time doing our work better, better for our patients, better for our community, and really being the catalyst in our communities. And you only can be a catalyst by setting the example yourself. So we got to live what we believe in. And when we talk about health for a better world, which is our vision statement, it is about a better world. And you can only have that through great environmental stewardship. And there's a direct correlation between what we do to the environment and how we affect health of individuals. So with that, this was fantastic. We could probably talk for another hour, and I know we'll be spending more time together. So thank you to both of you for really giving us an insight into what's an important issue that is not going to go away, that is going to be the big issue of the time, our environment. So thank you both on this Earth Day.
Thank you.